This week is National Public Health Week, and we have two representatives from Meigs County, Courtney Midkiff and Mark Barr, to tell us more about what that means. Thank you guys for joining me this morning.
Thank you for the opportunity.
So can you tell me, what is Public Health Week?
Sure. This is a platform and opportunity for us to highlight some of the major public health issues that we have going on right now.
And so why is having people educated about public health important?
It's very important because people don't realize what public health is and what it isn't. So public health is a science, but it's also about people and people's responsibility and roles in not only their own health, but also in the health of their communities. So a lot of people don't realize what public health can and can't do. And public health isn't just about the local health department. Public health is a system that includes, other social service agencies, other health agencies, behavioral health, schools, law enforcement, and the medical community. So I think it's just important that people realize that what their local health department does, but also how it interacts with the larger system overall. So
what are some of the key health issues that are currently impacting our community?
We did a community health assessment in Meigs County for 2023 through 2026, and what we found were the top 3 priority areas for our residents were access to care, mental health, behavioral health, and substance abuse, as well as health promotion, lack of access to physical activity.
Okay, and so what resources and services do you guys have to help people with those issues?
We are largely funded by a local tax levy that allows us to have the majority of our operations for the health department in Meigs County. We also have grants that we have specifically looked to get based on the needs of the community. We have a dedicated team of professionals at the health department who really love the community that they're in and make every effort to see that our people get what they need. And we do, I think, a very good job on networking within that public health community with other community stakeholders and including elected officials, just to make the best opportunity for our people. So I always say you can lead a horse to water, but you can't make them drink. So, but I think our people, if they know they can call the health department or come to the health department. We're not going to turn them away. If we can't do something for them directly, we are going to hook them up with another resource that's going to be able to help them. So I think we're that hub of resources for our community.
So what is an individual's role when it comes to public health?
Well, I think everybody has a personal responsibility for their own health, but also to have respect for others as well. So I think everybody is part of a bigger picture in this, and the public health just kind of guides that along.
Amazing. Well, thank you guys both. Do you have something else you'd like to add before we go?
No, I think Mark is correct with that, and I just want to take this opportunity for Public Health Week to appreciate not just our staff at the Meigs County Health Department, but the other local health departments in our region, as well as the other stakeholders that make up the public health system here in our area.
Amazing. Well, thank you both so much for joining me to talk about this really important week.
Thank you.
Thank you so much.
And we will have more coming up on Daybreak right after the break.